Hello. This presentation is an overview of social work as a profession. Social work is unique relative to other helping professions in that the study of social work includes a study of the organizations and institutions in which social workers practice. This presentation provides an overview of the profession, the broad fields of practice, and the organizations in which we work. It also reviews the knowledge and skills social workers need. I will touch on the values, but they are discussed in detail during the next section, in part because they are so important as they are the heart and soul of the work of social work. You will not learn everything in this course that I present, but over the course of your professional education, at least most of it should be covered. Some of the more specialized knowledge and skills you may learn after you graduate through continuing education, as we have previously discussed. Lifelong learning is very important. So let's start with the case. I do this because it is a good place to start when we think of the values, knowledge, and skills we need for helping. And it should be all about helping the client have good outcomes. In order to have good outcomes, we need to know what inputs or interventions provide the desired outcomes. So what do clients need and want from a social worker? Susan is a child of 6 who has spent 2 years of her life, including the first 3 months, in various foster homes due to the difficulties her mother, Frances, has had in coping as a parent. The difficulties were due to Frances's mental health problems and her ambivalent feelings toward her daughter, Susan, who was the child of a rape. Susan has most recently been in foster care for 4 months, and Frances has come to the decision that she cannot care for Susan and that she wants to release her for adoption. The social worker that will follow through on this request is called Joanna. What will Susan and Frances possibly need and or want from Joanna? As we go through the rest of the material in this section, think about this case and how some of the qualities, tools, including skills, and knowledge you think Joanna will need to respond to the wants and needs of Frances and Susan. Some of it may be the same, some of it may be different. If you remember in the previous presentation, we talked about how practice must be responsive to the developmental age and stage of clients. Susan is a young child, and Frances is an adult with mental health issues. So they're going to need some of the same things and some different things. So let's talk about the qualities of a good social worker. There are 3 primary sets of competencies that guide the curriculum and will guide your field practice requirement. These are values, knowledge, and skills. Values are what is good and desirable. As stated earlier, we will go into much more detail on the values and ethics in the next section. Knowledge. This is the information piece. It is very broad. It includes facts, theories, data. This could be lab reports or evaluations, such as psychological reports, and research findings, which provide the evidence that informs our knowledge base. It also includes laws, policies, and procedures. For Frances and Susan, knowing adoption laws and policies are going to be critical to helping them. They are most likely going to look to Joanna for that knowledge. Skills. This is the ability to do something. Listen, gather data, organize information, write clearly and concisely, follow through, convey empathy, avoid panic, motivate others, organize a process. These include a full range of skills including behavioral, such as writing, emotional, such as avoiding panic, and thinking, such as organizing data. So the qualities include a broad range of factors and dimensions. One of the most critical tools we have in our toolbox is what we call use of self. This is another way of presenting the values, knowledge, and skills that clients such as Francis and Susan need from their social worker. Relationship enhancement skills. This means engaging others, including traumatized children, mentally ill adults, those who may not be so easy to engage. Values and ethics. These are basic to accountability. Knowledge of human behavior theory, knowledge of skills, such as the problem-solving process, how to address motivation and work with resistance. In other words, how do we help clients begin to invest in changing when they have many reasons not to? Self-disclosure. What and how much do I tell the client about myself that can help and not harm the therapeutic alliance? Confidentiality. How do I use this, and when do I need to cross that line of keeping things confidential? Cultural competence. Having knowledge about another's culture and knowing when I need to respond differently. So let's talk about the characteristics of the professional relationship versus a friend. The professional relationship requires the conscious use of self, which we have just discussed. The professional relationship also has specific characteristics that are different from a friend, and these include: there's a specific purpose for the relationship. It is time-bound. There is an endpoint. It is client-centered. It is not mutually productive. It is basically focused on helping the client. The professional has authority that is based on specific policies and laws, such as child protection laws or adult protective service laws, that give a social worker the authority to move an individual from a particular caregiver to another. And professionals have certain external controls on their behavior and can be sanctioned if they do not follow required procedures and protocols, such as the right to information and confidential treatment. So let's talk about what a profession is. These are characteristics of all professions that we share with doctors, nurses, lawyers, psychologists, etc. I heard Dean Poddick go over these in orientation, so these are pretty basic, and I will say they'll be on your exam. All professions have a systematic body of knowledge. It's based in scientific theory, such as behavioral theory. All professions have a service mission. Professionals have a mission of service to society. The service mission of social work is to improve social functioning, help individuals navigate through their society, and help society provide resources to its citizens. All professions have a professional authority. We do have authority to make and or influence decisions in prescribed situations based on policy and or legislation. All professions have a regulative code of ethics. For social work, it's the NASW Code of Ethics. And all professions have self-regulation and sanctions. This is the accountability part, and it is often done through licensing, certification, and credentialing. McMahon's holistic conceptualization of social work provides a summary of the specific components of the profession in kind of a schematic presentation. This schematic is in the handout that you will find in Doc Sharing as well as in this section. So it includes the purpose, sanctions, values, knowledge and theory, skills such as relationship skills, problem solving, and political skills. I don't want to spend too much time on this, but this is an important overview of the profession, and this is from the handout. This pretty much provides the outline for Social Work Practice 1, which is social work with individuals, families, and small groups, and Social Work Practice 2, which focuses more on macro practice, practice with communities, organizations, and societies. Here are some examples of the knowledge base of social work. We have development across the life cycle, which is usually studied in your human behavior and social environment course, but also in other courses. So that's information related to biological processes, psychosexual, psychosocial, cognitive, and moral processes. Then we have our theories. These are more psychological and skill-based theories such as socialization theory, role theory, humanistic theory, cognitive behavioral theory, communication theory, etc. Many of these we'll be going over in this course. And then there's the knowledge base that is most related to macro-mezzo social work practice, such as organizational theory, political science, legislative processes, social policy, anthropology, including your broader social welfare systems. And then these are the skills that you'll be learning throughout your social work education and practicing in your field placement, as well as some of the application discussions and in your written assignments. So you have relationship skills such as engaging, listening and responding, feeling, sensing, paraphrasing, clarifying, information giving, referring. And then you have the problem-solving skills, which include problem identification, data collecting, assessing, goal setting, planning, task defining, implementing, evaluating, and terminating. And these, you will see, are covered in this particular course. And then the more macro skills include political skills, such as advocating, taking legal action, providing evidence, bargaining, organizing, publicizing, and demonstrating. And then let's not forget your professional skills, which are critical across all different settings: recording, research, time management, and teamwork. So let's talk about practice theory. How can theory help me in working with my clients and within the organization? There's always a tension around theory. Sometimes in the course evaluations, not just mine, but some, not all, students say, I wanted to discuss my cases. I thought this class was about going over my field cases or learning what I need to do with clients. Field supervisors have pointed out that sometimes students have difficulty understanding the theory they're using or how to apply the theory that they know. So let's go over the specific characteristics of practice theory. Practice theory explains and interprets professional behavior and guides our actions. It also describes what models are most effective for which populations, such as our case that we presented. What models are going to be most helpful in understanding the adoption processes? Practice theories change over time. For example, we're learning much more about the impact of biology on behavior from neuroscience. The theory we use defines our assessment and intervention. If I define the problem as psychological, then my intervention will be psychological. If I think it is because of discrimination, then I address the problem from a systemic perspective. Also, good practice is based on strengths-based, collaborative, and empowering theories. So, the theory we use has important implications for interventions and outcomes. Therefore, conscious use of theory is a critical part of the conscious use of self. There is a science and an